Welcome to this explainer. And today we're kind of diving into this whole thing about governance by delegation and honestly, the illusion of our National Health Service. And it's like, listen to this really stark reality. The true scandal is that responsibility actually exists and still the suffering just carries on. The NHS constitution promises us fairness and safety, right? But then on the ground, that really comforting promise is just totally fractured. And then along comes the 2022 Health and Care Act. That's the point where legal accountability got reorganized and basically pushed completely out of sight. And we call this governance by delegation. It's essentially offloading the legal duty of care into this messy web of providers. And the government calls it local partnership, but legally, it's like this trap that totally hides the loss of duty. So let's just look at this liability loop in action. Imagine a patient with really complex needs trying to navigate this highly fragmented maze. They're just bouncing around like a hot potato. Primary care puts up barriers, specialists limit referrals, and urgent care can't even find the boss. And the really crazy part is that a sick, cognitively destabilized patient is literally forced to coordinate their own emergency care. And these administrative contracts just act like a paper shield in a crisis, leaving the frontline staff who are trying to navigate all this with this huge amount of moral distress. So when the system breaks down, you kind of have to ask, like, who actually holds the legal duty of care and who's really carrying the risk? And operational risk just sort of gets pushed down locally, but then patient protection is left in this really structurally ambiguous place. And then, who actually reports to Parliament? The government's whole line of legal accountability has basically turned into this complete black box. And Parliament even formally admits that implementing these really vital patient safety recommendations still, dangerously needs improvement. Yet we've got these massive 2026 restructuring plans charging ahead without even checking if the previous reforms actually worked. And this isn't just, bureaucratic noise. This kind of administrative fragmentation causes real measurable human casualties. Like, just look at that staggering 37% spike in youth self-harm admissions. That's literally the cost of systemic instability. And meanwhile, those legacy workforce reductions of 30 to 40% have totally gutted the system's safety oversight capacity. And a publicly funded service just can't ignore outcomes like that as if there's some inevitable administrative side effect. So the solution really needs to be a constitutional impact assessment before any more restructuring happens, just so legal responsibility becomes clearly visible again. Because if everyone's a partner, then honestly, who is actually in charge?